Many of us look forward to a massage as a way to relax our bodies and calm our minds. We think about soothing music, a comfortable table, the release of muscle tension. But for some, a quiet worry can creep into this picture of tranquility. It is a question people often feel too embarrassed to ask their doctors or massage therapists. Can I get a sexually transmitted infection or an STI from a massage? This fear is more common than you might think. It stems from a misunderstanding about how these infections are transmitted. The massage environment involves close personal contact, shared surfaces like the massage table and linens. Let's start with the basics. What exactly are sexually transmitted infections or STIs? The name itself gives us a very big clue. They are infections that are primarily passed from one person to another during sexual contact. This includes vaginal sex, anal sex, oral sex. These infections are caused by tiny living things like bacteria, viruses, parasites. Think of them as very small germs that can make people sick if they get inside the body. Some common examples you might have heard of are chlamydia, gonorrhea, herpes, HIV. It is helpful to think of these germs as being very specialized. Now that we know what STIs are, let's look closer at how they actually travel from one person to another. The most common way this happens is through the exchange of bodily fluids during sexual activity. This includes fluids like semen, preseminal fluid, vaginal fluids, and blood. When these fluids from an infected person come into contact with the mucous membranes of another person, the germs can get in. Another direct route of transmission is through significant skin-to-skin contact with an infected area. This is particularly true for STIs like herpes and human papillomavirus or HPV, which can cause sores or warts on the skin. Notice what is not on this list: casual contact. Things like hugging, shaking hands, sharing toilets, or using the same swimming pool do not spread STIs. The germs that cause these infections are not designed to survive the journey through the air or on dry surfaces.